Charting symbols. There are many other charting symbols that we use. I will say what the name is, explain what it means, and then show you how to chart them. Missing. This is when a tooth cannot be seen in the mouth. This is how you chart a missing tooth. Unerupted. This is where the tooth is existing, but it hasn't erupted through the gums yet, so we can't see it. That is called unerupted, and you mark a U with an E above the tooth. Partially erupted. This is when a tooth has started to erupt and it's just poking through the gums, but it isn't fully erupted yet. This is called partially erupted. You put a P, E above or below the corresponding tooth. Impacted. This is when a tooth is trying to erupt, but there isn't enough room for it and it gets stuck. Usually this is on people's wisdom teeth. To symbol an impacted tooth, we write IMP. To be extracted. This is when a tooth needs to be extracted and you have one diagonal line across the tooth. Has been extracted. This is when the clinic has extracted a tooth and that has two diagonal lines through the tooth. RCT. This stands for root canal treatment. Once the patient has successfully completed a root canal, we can write RCT above or below the corresponding tooth. PFM crown. PFM stands to porcelain fused to metal crown. This is a type of restoration, so you would need to write PFM above or below that tooth. FGC. This stands for full gold crown, so a gold tooth. You would just write FGC above or below the corresponding tooth. A bridge is where there has been a missing tooth and it has a crown on either side with a false tooth in the middle. This is how you chart a bridge. Fracture. This is where the tooth has been chipped. The fracture symbol is the same as a hashtag, and you should write that down first. You can have a small fracture or a large fracture, and the operator will give you the surfaces that it involves. For example, a fracture on the 1-1 mesioincisal looks like this. A fracture on the 1-2 distoincisal looks like this. A fracture on the 2-1 involving the mesial incisal and distal surface looks like this. Watch. This is when the operator just wants to keep an eye on that tooth. So you put a W and a line pointing to whatever surface they say. For example here, the 3-6 has a watch on the occlusal. Staining. Sometimes they like to record staining of a tooth, so we use the symbol ST. And just like the watch, we have a line pointing to that surface. Mobile. This is if the tooth is a little wobbly, perhaps ready to fall out. So we would write MOB above that tooth. Overhang. This is where the filling does not join smoothly with the tooth and it can get caught when flossing. It is represented by a little right angle wrapping around the surface. Diastema. This is the dental term for a gap between somebody's teeth, usually their upper centrals. So a diastema is 2 strokes in between the corresponding teeth. Non-vital. This means that the pulp inside the tooth has died. Often this presents as a grey colour and requires a root canal treatment. A non-vital tooth, you put NV above or below that tooth. If a tooth is satisfactory and there's nothing wrong with it, we call that sound, and you can write an S to represent that. Some operators might use the term OK. You may come across other symbols, but this is just the basic ones you will need to learn at TAFE.